Children under the age of 5 will likely have to wait a little longer to get vaccinated against COVID-19 after the FDA delayed its review of Pfizer's shot. On Sunday, former FDA commissioner and Pfizer board member Dr. Scott Gottlieb explained the decision to Face the Nation moderator Margaret Brennan. Listen.
The issue here is the ability for the FDA and for Pfizer to clearly define the level of efficacy that the vaccine is delivering. And what you have is a situation where the data set's continuing to evolve because we're still in the middle of this Omicron wave of infection. There's still infections accruing on the patients in the clinical trial, both the patients who've been vaccinated and the patients who've been unvaccinated. And so the data set is changing. And there was additional data that was submitted to the FDA late last week on Thursday and Friday that changed the FDA's perception of the absolute efficacy of the vaccine. And given the fact that that is changing, that's evolving, new data is accruing, it's hard for the FDA to give its advisors a fixed snapshot of what the absolute efficacy is of this clinical trial, of the data set. And so if they wait a little longer, if they administer the third dose in that clinical trial, they're not only going to have perhaps a better measure of effectiveness from this trial, but they'll also have a settled data set. They'll have a very firm picture of what level of effectiveness the vaccine is delivering. And that's important for patients and pediatricians to be able to make fully informed decisions because it's important to know that the vaccine is safe, but it's also important to know what the level of effectiveness that's delivering is.
All right, for more on this, let's speak with Dr. Dyan Hes. She's a pediatrician and founder of Gramercy Pediatrics right here in New York City. Dr. Hes, good to see you again. So, how does this delay impact parents and children? Are you hearing from parents in your practice that they're concerned about not having a vaccine for their children, those of their kids who are aged 5 and younger?
Yeah, people are heartbroken. I mean, they were calling already last week trying to register for the vaccine, and we had gotten emails from the Department of Health to register to get your shipment. So, you know, it's just another letdown where the kids have been forgotten this whole time. And I'm so upset because these trials should have started sooner in children. They should have been pushed forward sooner. So everything for kids has been delayed. And, you know, I've said this all along, the kids are the ones suffering the burden of this pandemic where they're the least affected as well.
And Dr. Hes, we already know that there is a very low vaccine rate for elementary age children above the age of 5 for whom the vaccine has been approved. I think it's about 24%. Are there concerns now that the slow uptake of vaccines might be made worse by requiring 3 shots?
I don't think so, because in pediatrics, most of our vaccines are given in series of 3 to 4 vaccines. So that's not really alarming to me. And I think for most parents, you know, they're used to coming back at 2 months, 4 months, 6 months for their diphtheria, tetanus, pertussis, for their polio, for their hepatitis B. That's not alarming. I think all of the yes, it's approved. No, it's not approved. Yes, it's approved. It's coming. That is what's going to make people hesitant.
So what is your advice for parents stressing over this virus and their kids? I mean, we've been asking you that for almost 2 years.
Not saying there's anyone at this desk currently stressing, but maybe there is.
Like a free consultation.
I personally think by the time the vaccine is approved, most of the children under age 5 will already have had Omicron. It is so contagious. The masks aren't really working to prevent it. That's what we saw. That's why we had the January surge, right? Even with the kids wearing masks, they got Omicron. The good thing is it's not so dangerous. It's it's becoming more like a real, regular flu-like illness. It's not as virulent, so the kids may be sick for a few days with high fever. We're seeing some different things, like we're seeing croup with this Omicron variant, and we didn't see that with the original strain. But the kids are doing remarkably well, and they're going back to school after 5 days. And I personally think the 5-day quarantine should be dropped because it's just like a cold, and some kids get better in 1 day and they shouldn't be missing school anymore. And I think then what's going to happen is I really don't think they're going to be able to force people to take a vaccine when their kids have already been infected with it. I think it's going to be optional. I don't think they're going to be able to say you have to take this vaccine because it's not 100% going to fight Omicron. It's not the same. We're not dealing with the same crisis that we dealt with where everybody really needed to get the vaccine, especially adults in March 2020. And I think it's going to be a very hard sell. That's what I'm very pro-vaccine. I want my patients vaccinated, but I can already hear the pushback.
Yeah, and of course we want parents to have that option available to them if in fact it's safe and effective. Before we let you go, though, you were talking about the mask mandates. I want to ask you a question about that. What do you make of many states deciding to lift these these mask mandates, particularly in schools?
I'm very supportive. I mean, I knew Governor Hochul wasn't going to relax that mandate. I think the masks have been totally ineffective. If anybody wants to come and watch me work every day and see kids with tons of colds and tons of COVID, they're all wearing masks. It's not working. The mask really worked when we had the first surge and we had the second Delta. But for Omicron, the masks are not preventing these kids from getting sick. They're still getting sick. So they're having the repercussions of wearing a mask with speech delay and social anxiety and, the rashes on their face. And we have fungal infections around the mouth and perioral dermatitis. And they don't know how to see facial expressions, but they're keeping the masks on out of fear. And I don't think that's how you should make a decision. I think it should be based in science. And the WHO never said that children under 5 should be masked at all. And what about all the kids who are vaccinated? They're still wearing masks. Polyprep tried to drop the mask mandate, the private school in Brooklyn, and the state came down on them so hard. Every single person in their school is vaccinated. Every employee, every student, and they're not allowed to drop the masks. So it's really not fair at this point, and it's not based in science, is my opinion.
So, Dr. Hes, just to be clear, we're talking about young children here, because for adults, if you're wearing an N95 or if you're wearing a surgical mask and you're wearing it properly, you still believe that that is an effective way to prevent transmission of any virus.
Right, but that's your option. Kids are not given an option. They have to wear it. And many studies have shown that the masks don't do anything for kids under age 5. I have given it the benefit of the doubt. We have run the gamut. For 2 years I've been doing this. All of my patients were wearing masks in school, 2 years and up. I couldn't pick up the phone fast enough in December because everybody had COVID. Same in January. The masks are not working. At some point, you have to rethink your plan and base it on science. That's why other states have evolved. New York has not. That's why the WHO said from the get-go, no masks under age 5. This is a common cold now in kids. They should not be masked. They're suffering much more from the masks than they are from COVID.
Important information there, as
An
always.
interesting counterpoint to a lot of other perspectives we've heard. Dr. Dyan Hes, thank you for joining us, and thank you for all that you do.